Come in.
Just phoned in. Hi, my name's Carissa. I'm a nursing student and I'm going to be doing a head-to-toe assessment on you today. Can I get your first and last name and date of birth?
Aiden Downey, April 17th, 1999.
Alright, I'm just going to go ahead and check that on your wristband. Perfect. Okay, do you have any allergies I need to be aware of today?
Nope.
Okay, perfect. So like I said, today we're going to be doing a head-to-toe assessment, so I'm going to be listening to some of your lung sounds, heart sounds, and touching you places. Go ahead and let me know if you're uncomfortable at any point, okay?
Okay.
Is this okay with you?
Yeah.
Okay. Alright, so first general assessment of the patient is that he is of good hygiene, his hair is evenly distributed, his respirations are even and unlabored, he does not appear to be in any pain or distress, is alert and talkative, and answering my questions, appears to be his stated age, and he is dressed appropriately for the weather. Okay. So first I'm going to start off with a few subjective questions. Have you noticed any changes in your hair, skin, or nails?
Nope.
Okay. Do you often have dandruff or dry skin?
I get dandruff sometimes.
Okay. And what do you do for that?
Head and shoulders.
Shampoo?
Yeah, shampoo.
Okay.
Mm-hmm.
Have you noticed any shortness of breath when you're walking around doing your daily activities?
Nope.
Okay. Have you had any trouble walking, any pain while you're walking, or any pain during your daily activities?
No.
Okay, so you're not having any chronic pain?
No.
Okay. Do you smoke tobacco or vape?
No, ma'am.
Okay. Do you drink alcohol?
Yes.
How often?
Maybe twice a week, 2 or 3 times a week.
Okay, how much do you normally drink on those days?
Like 2 drinks, 2 or 3 drinks.
Okay, perfect. Have you noticed any changes in your eating habits?
Nope.
Okay, and do you have regular bowel movements?
Yeah.
Okay, have you been experiencing any nausea, vomiting, or diarrhea?
Nope.
Alright, so the first thing I'm going to do is I'm going to check some of your cranial nerves in your face. So the first thing I can have you do is, can I have you smile, frown, puff out your cheeks, and raise your eyebrows? Okay, patient was able to do all of those, so it appears that his facial nerve 7 is intact. The next thing I'm going to do is I'm going to go ahead and observe your the inside of your mouth. So go ahead and open for me. Using my pin light, I'm going to look and see. I cannot see his tonsils, so that would be 0. The inside of his mouth appears to be well hygiened. He's not missing any teeth. It is moist and pink inside, as well as with his tongue. Like I said, his tonsils were not swollen. He appears to have good dental hygiene. His lips are smooth, pink, and have shown no signs of lesions, along with the inside of his mouth. The oral and buccal mucosa is pink and moist. And finally, can I just have you open your mouth one more time and say ah?
Ah.
And the uvula is midline and raises as to be expected. Okay. For the next part of this assessment, we're going to be assessing your eyes. First thing I'm going to do is just go ahead and inspect. It appears that the sclera is white as to be expected. Can I have you pull down your eyes so I can look at your conjunctiva a little more? Okay, conjunctiva is clear and pink as to be expected. The eyes are in good hygiene and showing no sign of discharge. So the next thing I'm going to be doing is checking. Okay, for the next part of the assessment, we're going to be checking to see that his eyes are perla or pupils are equal, round, reactive to light, and accommodate. So as I can see, the pupils are equal and round. I'm going to go ahead and shine my light in there. Pupils constrict as to be expected, and his other pupil has consensual constriction as well. So now I'm going to do it on his other eye. Perfect. Pupils constrict as to be expected, along with the consensual on this side. So his pupils are reactive to light and equal. And finally, to check accommodation, can I have you look straight at me and look over here past my shoulder? Perfect. And now look at this. Okay. Pupils are do accommodate as the pupils get dilated for distance and are constricted for a closer object. So the next part. Okay, for the next part of the assessment, I am going to check his 6 cardinal fields of gaze. Checking his cranials 3, 4, and 6. So go ahead and follow this pen for me. We're checking for any signs of nystagmus. Seeing if his eyes are moving equally, down, and to the sides. All right, and no signs of nystagmus or shaking to be noted. Okay, next on the assessment, I'm going to go ahead and also take 5 different spots on his heart. We're going to start on the right side, the aortic, on the second intercostal space, right side. Move over to the second intercostal space on the left side. Pulmonic, move down to the third one, Erb's point. Fourth intercostal space is the tricuspid valve, and moving down one more to the mitral valve. I should be hearing S2 louder than S1. S2 and S1 equal, and S1 is louder than S2, as those are the valves that are closing. So I'm going to go ahead and listen with the diaphragm of the bell, or the diaphragm of my stethoscope. So you can just breathe normally for me. S2 is louder than S1. S2 is louder than S1. Move down to Erb's point. S1 and S2 are equal. Move down one more. S1 is louder than S2. And one more to the mitral valve. S1 is louder than S2. Okay, moving on to the next part of the assessment, I am going to inspect and palpate his upper extremities. Upon first inspection, they are pink and intact. I'm not seeing any breakdown on either of his olecranon processes. There appears to be no signs of lesions or petechiae to be noted. I'm going to go ahead and palpate. Let me know if you have any pain, okay?
Okay.
Any pain?
Nope.
Okay, so skin is bilaterally warm, pink, and dry to the touch. He did not have any pain upon palpation. I'm going to go ahead and check your capillary refill. Less than 2 seconds, showing good perfusion on both sides. Checking his skin turgor. Less than 3 seconds, showing good hydration. Like I said, his skin is warm, pink, and dry, showing no signs of infection. It is also intact, no signs of skin breakdown. While I'm up here, I'm going to go ahead and palpate his radial pulses. So I'll have you go ahead and give this to me. 2 fingers. Okay, pulse is 2 plus. Go ahead and check on the other side. Pulse is 2 plus bilaterally. Upon first inspection, the chest appears to be symmetrical, not showing any signs of concaving or barrel chest. It's even and symmetrical, no obvious pulsations, and his respirations are even and unlabored. I'm going to go ahead and listen to some breath sounds.
I'm hearing bronchiovesicular. Okay, bronchiovesicular, cleared auscultation, no adventitious lung sounds, such as crackles or wheezings. 6 deep breaths through your mouth again. When my stethoscope touches, I'm just going to be listening for any adventitious lung sounds. Hearing bronchiovesicular. You can take a break if we need to. Bronchiovesicular, and 2 more spots. Okay, lungs are clear to auscultation, no adventitious lung sounds such as crackles or wheezing to be noted.
Moving on to the abdominal portion of the assessment, I'm going to go ahead and inspect. Upon inspection, umbilicus is midline. His musculature is even. I'm not seeing any obvious pulsations or scarring. And move on to the auscultation portion. I'm listening for bowel sounds in all 4 quadrants. Bowel sounds are normal active in all 4 quadrants. If I didn't hear anything, I would listen for 5 more minutes and then declare them absent. I'm going to go ahead and move on to the light palpation portion of Go ahead and let me know if you have any pain or tenderness, okay?
Mm-hmm.
Any pain?
Nope. Nope. Nope.
Okay, you reported no signs of pain or tenderness. I did not feel any obvious pulsations or herniations. So I'm going to move on to the deep palpation. Once again, let me know if you have any pain, okay?
Okay. Nope. 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 Nope.
Okay, so he has no guarding, showing no signs of pain as he stated. He does not have any. Next, we're going to be checking for any signs of CVA. I'm going to percuss your kidneys. Let me know if you have any pain, okay?
Okay. Nope. Nope.
Okay, he was negative for pain, so we're going to assume that he does not have any signs of CVA at this time. Okay, for the next part of the assessment, we're going to be checking your musculoskeletal system. So for the first thing, I'm going to have, we're going to do some upper body. So we're going to do some range of motion activities. So if I could have you abduct your arms and bring them up, and adduct and bring them back in. Okay, and I will go ahead and have you do flexion and extension. Any pain?
Nope.
Okay, I'll go ahead and have you do external rotation and internal rotation and range of motion on his upper extremities. So we'll go ahead and test his muscle strength. We're going to do the same thing except just with resistance. So go ahead and push out against me. Perfect. And push in against me. Good. That's external and internal rotation. I'll go ahead and have you do flexion and pull them up from you. Good. And extension behind you. Good. Go ahead and put your arms out for me. Flexion and down. Extension. Good. Full range of motion. 5 out of 5 muscle strength. I can see both of your hands. Go ahead and squeeze my hands for me. Okay. Squeeze them as hard as you can. Okay, good. 5 out of 5 muscle strength on his hands too. Okay, so if I can have you externally rotate your legs. Okay, and internally rotate them one at a time. And a abduction, both sides, and a deduction in. And just the hip, so pull your hip up, both sides, and extension behind you. Any pain while you're doing that?
Nope.
Okay, and pull your foot up and point it for plantar flexion, and pull it up for dorsiflexion, both sides. Okay, he appears to have 5 out of 5, or he appears to have full range of motion. So we're gonna go ahead and move on with the muscle strength. We're gonna test his muscle strength one at a time. So go ahead and push up against me for extension, and push up one more time for me. Extension and pull down for flexion. Okay, extension and pull down for flexion. Good. Go ahead and push up and hold it there, please. And then pull down. Good. Push up and pull down. Okay, that's checking his hips. He has full range of motion of those. Go ahead and push out against me for external rotation and in towards me for internal rotation. Good. And okay, on the final part of the assessment, I'm going to go ahead and look at his lower extremities, observe them and palpate them. I didn't do this at the beginning because I don't want my dirty hands touching his upper body. Otherwise, I'd have to refoam in. So upon inspection, there's no presence of lesions or edema to be noted. There's no petechiae or ecchymosis that I can see. His skin appears to be dry and intact. I'm not seeing any skin breakdown on his calcaneuses. So I'm going to move on to the palpation. Let me know if you have any pain.
Nope. 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 Nope.
Okay, and check for edema on his lower extremities. There's no pitting on the tibial plate, showing no signs of edema. He did not have any pain or tenderness upon palpation. I'm going to go ahead and check his capillary refill, less than 2 seconds. Go ahead and move over the dorsalis pedis and try and find a pulse. 2+. And 2+ bilaterally. Sorry. And push down for plantar flexion and pull up for dorsiflexion. Good. And I'm gonna do the same thing on the other side. Push down and pull up. Okay. Good. Do you have any questions for me today?
Nope.
Okay, and I'm gonna go ahead and fill them out.